Okay, Zanelli.
Okay, we are live for the Google Hangout with Girls Globe. I am Zanele Mabaso, and I'm part of the Girls Globe, which is a global community of women across the world who activate or advocate for adolescents and women's health and rights, as well as resource mobilization across the world for women and girls. So we are here for the Google Hangout with some of the youth representatives who were at the Global Strategy for Women, Children, and Adolescent Health consultations in Johannesburg. So they will be sharing some of their experiences and perspectives on the zero draft. So first, we're just going to look at what the strategy is. It's basically a 26-page document that is aimed to mobilize the highest level of political support and to mobilize the RM and CH community. It is also meant to identify and support top priorities and create a roadmap for the direction, goals, and targets and key action for the global strategy moving forward. So we do have some youth representatives here whom I will allow to introduce themselves. But before the panelists introduce themselves, I'd like to call on Diane Fenter from Girls Globe to share a few messages regarding the social media. Diane?
Thank you so much, Zanelli. We're so excited to have everyone listening in to this Hangout. We want to encourage those that are watching to participate online via the hashtag #CommitToDeliver. If you have questions or comments, you can ask them using that hashtag. We also want to encourage you to write your comments in the comment box or ask questions in the comment box, as all of your feedback and questions and comments will actually be utilized in a summary following this Hangout that will actually feed into the renewed global strategy for women, children's, and adolescents' health. And so your voice matters as well, and we want to hear from you not only during this Hangout, but so that we can utilize your comments and suggestions later as well. So we just want to encourage you to participate. So I'll hand it over back to Zanelli.
Thank you so much, Diane. Yes, you did hear. If you are on Twitter, you can also post your questions with the hashtag #CommitToDeliver. So now moving on to our panelists, I'll allow yourselves to introduce yourself, starting with
Yemere, if you want to introduce yourself, you can go ahead.
Okay, my name is Yomura Nyoni. I'm a founder and advisor at an organization called Dot Youth Zimbabwe. I'm also an outgoing Women Deliver 100 Young Leader and was one of the recipients of the Exchange Initiative grants, and I've been carrying out work to end child marriage in Zimbabwe. It's good to be here.
Tikala, if you want to introduce yourself.
Okay. Hi everyone, my name is Takala Itaye. I am a youth activist. I am a co-founder of an NGO called Her Liberty Namibia that works with young women and children. I'm also the vice president of AfriYan Namibia. AfriYan stands for African Youth and Adolescents Network. So it basically works with youth organizations relating to health, gender issues, and youth development. I'm also the interim Southern African representative of AfriYan Namibia, so we also work with the Southern African youth-led organizations in regards to the same issues. Yeah, it's good to be here.
Okay, thank you so much, Itaye. Now we'll move on to Yemurai. Have you introduced yourself, Yemurai from Zimbabwe?
Yes, Sanele, I have. Thanks.
It seems that Zanelli might be having some technical issues, but I want to just pose the first question to you, Yemrai and Takala, and that is how, so looking at the Zero Draft, how does the Zero Draft specifically address health challenges related to adolescence, and what are some positive takeaways from that? Yemrai, we can go ahead and start with you.
Okay, thank you, Dan. Well, I'm excited about this strategy because it says first of all that we want to make sure that we survive, thrive, and transform, which I think is a really good way to start up with the strategy that deals with global health for the next 15 years. I say that because a lot of the work around health has been focused on preventing death as opposed to allowing people to enjoy their lives to the fullest extent possible. So I'm happy about that. I'm also happy that the current draft strategy speaks about the demographic dividend. I think this is something important for within the African context, specifically looking at how issues of family planning, issues of providing comprehensive sexuality education will provide an opportunity for the continent to have as many young people involved in the productive labor and eventually allow the continent's economy to grow. So I'm glad that the document is centered also on harnessing from the demographic dividend. I'm also happy that the strategy speaks about other determinants of health, that it speaks strongly on issues of education and ensuring that we include the discussion on universal primary and secondary education in our discussions on health, because we know that already is an entry point for example, health education, and also equips, especially adolescents and youth, to better deal with life issues that they face later, and to also increase their economic prospects and their ability to negotiate around different health challenges. Lastly, I think I'm happy also about the inclusion of broader health issues. There are discussions on mental health, discussions on nutrition, which really we haven't spoken about a lot in terms of adolescent health. So I'm excited that the document has this additional focus, which allows us to really look at a broader range of health issues affecting adolescents and youth. So yeah, I think that's what I would say is good and exciting.
Okay, thank you so much for sharing that with us, Yemurai from Zimbabwe, sharing his perspectives on the draft report. Now we will also pose the exact same question to Itaye, who is currently in Geneva, on how does the Zero draft specifically address health challenges related to adolescents, and what are some of the positive takeaways? Itaka?
Thank you so much. With that question, well, I was really, really, really amazed and so grateful at the fact that the global strategy already involved young people at the consultation. We were there to actually deliberate on it. So one main thing you'd say, the involvement of young people to actually be participating in reviewing the global strategy itself, was a key highlight for me. One of the things within the document itself I found really moving was that the issues of adolescence is now visible. I mean, previously in the other strategy, there was no visibility for adolescents. So now we're actually, finally, they're actually acknowledging that adolescents' health is a big and a key priority that we need to invest in. If we look at the population size of 1.2 billion adolescents in the world, which 22% makes up the one within Africa, you find that this is a big group of people that we can't even ignore, and it's a key priority that the strategy has put itself. So for me, the visibility of adolescents was number one. And secondly, when we're looking at accountability, that's something that we definitely need to always consider, because we can put strategies together, we can put amazing documentation together, but how do we hold our political leaders and the implementators of this document accountable? So the fact that it actually considered accountability as a key priority was also a very key factor for me. Another thing you would say is that, as Yamurai was saying, they really included a broad aspect of the health issues for adolescents, which is good. And they also touched on an investment case and really investing in adolescents' health within the strategy. So for me, those were the key things that I felt were right on point with the strategy. Yeah.
Kaye, for sharing those. Yes, indeed, we are glad that the strategy did also now incorporate adolescents and make it more visible. You also touched on a very important and critical point, of which is how do we hold our national leadership accountable, which we'll also address much closer to the end of our conversation. But the next question posed to Yamurai and Itakala Itaye is, the notes of preventable adult deaths are linked to factors that begin in adolescence. Now, to reduce this percentage, how can we approach addressing issues such as child marriage, road injuries, mental health, HIV, and other issues in a holistic and integrated way? Can you share examples from your work? We'll start with you, Yamurai.
Okay, thank you, Zanele, and thank you, Tikala, also for highlighting the additional issues that the strategy points out. Yeah, in terms of the kinds of approaches that we need to take, it's very interesting that the strategy highlights that fact that 70% of preventable adult deaths start in adolescence. It means that the entry point for global health as a whole is indeed investments in adolescent health. One key thing which I'd like to highlight is the fact that dealing with adolescent health as well as youth health is different to how we deal with the health of children. A lot of our work previously that I have seen, for example, in implementation in Zimbabwe, has focused on one small strategy, a quick fix solution to make sure that perhaps we just get rid of all these health challenges as we would with children. But there's no, as I said, I think in the consultation we had last week, there's no vaccination for child marriage. There's no immunization for mental health challenges. You have to have a broad range of approaches if you're really going to get good health results for youth. But specifically looking at perhaps the issue of child marriage, I've seen the importance of first of all, creating an enabling environment to ensure that girls and young women are not forced into marriage, including through changing laws and engaging members of parliament to bring a change in laws, but also finding a balance between creating an enabling environment as well as ensuring that the intended beneficiaries are the ones who really benefit from what we do. So key to that has been for us, for example, as .youth, we've mixed our work readiness program with our work on child marriage. So we work with young mothers, we work with young fathers as well to make sure that they are able to get access to work. We equip them with life skills and livelihood skills to make sure that they prevent future pregnancies, and to also make sure that they can, for example, if they want to get involved in entrepreneurial activities and so forth, it becomes easier for them to do that. So basically, just having a mixture of approaches and making sure that we focus on the target beneficiaries in as much as we look at creating an enabling environment. So yeah, that's one of the ways that we've found that works, and that perhaps can be taken forward also as we go through the strategy and recommend work for other organizations working with adolescents.
Thank you for sharing those examples from Zimbabwe that you have worked in, Yemurai. Indeed, using different approaches to these social issues can assist with combating child marriage and all those other issues as well. Now, I'd like to hear from Tikala on what she thinks are some of the examples that might work to reduce the percentage of preventable adult deaths. Tikala?
Thank you so much, Zanelli. As Yamarai was saying, I totally agree with him in terms of collaborative work as well, involving to touch likely indirectly, but on something like that, targeting young people themselves, because you find that young people know these issues, and the fact is, youth organizations are with young people in the community, within the rural areas, within the hospital clinics, so they're able to actually relate to young person level, and that already I think is influential. So actually the acknowledging of youth-led organizations as stakeholders is a key factor. Secondly, looking at evidence, we found that using evidence as a way of action, when we have evidence on what is the situation at hand within the communities, what is the situation at hand within the rural areas, what is data telling us in terms of, you know, the percentage of people who don't have access to healthcare, who don't have access to treatment, who don't have access to information on these respective issues, that data is very useful, because you can use that data to approach government, to mobilize resources, to be like, this is the situation at hand, and with this situation we need to mobilize resources to ensure that we have a program running in that respective area. On my side, I'm also the core chairperson within a national technical working group in Namibia, where I work with the Ministry of Youth under the head of health programs. And what we do is we have stakeholders from respective organizations, civil society organization, ministry representatives that sit together and basically discuss on the root. You need to find out and deliberate on the root causes and the determinants of these issues if you're going to come up with sustainable long-term programs that will effectively reach out on these issues. So I would say, again, collaborative work and investing in research on the key determinants and the root causes, because with that you're able to come up with sustainable solutions and not short-term solutions, as Yamarai was saying. And yeah, that's basically it in a nutshell.
Thank you, Tikala, for sharing those innovative strategies that we can adopt in trying to reduce your preventable healthcare. Yes, now, as Yamurai had said and shared some of the examples from Zimbabwe, it is important for us to engage parliamentarians in changing laws so that we can combat issues such as child marriage and so forth. And he also shared on the work readiness program that they are implementing in Zimbabwe, dealing with child marriage and how they assist in capacity building, giving them life skills and all those skills that are essential for them to engage in the economy productively. Also, Tikana did highlight some of the examples as well that she believes could be utilized in decreasing the high and staggering rate of preventable deaths, highlighting that youth organizations need to be stakeholders in all engagements, as well as investing in research as well as evidence-based data that will assist in improving healthcare systems, as well as just building sustainability in all the things that we do. So we're just going to go and cross over to Diane from Girls Globe, who will look at social media and adapt a question that might have been posed by one of our audiences. Diane?
Thank you so much, Zanelli. We do have quite a conversation going on Twitter, and so we just I just want to pull a question asked by Julia Wicklander, and that question is, what are the biggest priorities voiced by youth for the global strategy for women's, children's, and adolescents' health. What are you hearing from the constituencies and youth networks that you all work with every day? What are you hearing from them as key and main priorities? We'll start with Yemurai on that one.
Okay, thanks, Dan, and thank you, Julia, for asking that question. I'd say there are two key things that keep coming up in conversations we have. The first is that we need to be willing to deal with often unsafe issues, issues that are easy to run away from. You'll find that dealing with, for example, road traffic accidents is a lot easier or more politically correct than dealing with issues of safe abortion. But we know that as we look at adolescent health and the challenges, for example, of adolescent pregnancy and childbirth, as we look at the discussion of the demographic dividend, a lot of these challenges are focused on sexual and reproductive health. So we need to be able, for example, within the African context, to confront and address sexual and reproductive health issues, to allow for the protection of the sexual and reproductive health rights of adolescents and youth, which include the rights, for example, to get tested for HIV, to know one's HIV status, to make sure that adolescents have secured access to antiretroviral therapy, to make sure that schools provide compulsory or have to provide comprehensive sexuality education, including life skills and livelihoods, and also to make sure that governments take action to provide for safe abortion in the case of unplanned pregnancy. So some of these are key issues, and for us to be able to get to the health we really want in 2030, we need to tackle unsafe issues. The second point that's been raised is the need for increased youth involvement in accountability. I think Tikala pointed this out earlier. So if we have a strategic area on adolescent health, we need to make sure that we have as many adolescents involved in holding different stakeholders to account, including ourselves as well. And that includes through the involvement of youth in youth-serving organizations that also provide services, that also carry out work in terms of advocacy and so forth. So it's to deal with the unsafe, politically incorrect issues, and also to make sure that we maximize youth participation in holding governments to account for the strategy to really get to where it's supposed to get to.
Thank you, Yemurai. Tikala, I'm wondering if you have anything to add?
I was actually just thinking the same thing. Yemurai touched on everything, but what I can add on is we also have to look at the issue of priorities for us on what we work on is the services provided when it comes to health issues. Yemurai basically mentioned the key elements on what we actually look at and on what subject topic are we looking at when it comes to adolescent health. But we also would like to also look into the services as well that are provided. That's a priority for us. What type of quality services is being provided for young people and adolescents within the healthcare location of these places, because you find that not most of these health-friendly services can be accessible to all young people. We have to look into issues and matters where related to young people actually accessing the information related to sexual reproductive health or any other health issues. One other key element is that we're not only focusing on sexual reproductive health, we're talking about sanitation, we're talking about the environment that young people are in, we're talking about nutrition as well, especially when you're looking at adolescents. So we don't actually prioritize in terms of certain elements to it. It's kind of very broad. Like Yemurai kind of mentioned a whole lot of lists, but there's a lot of things going around adolescents' health. So what we look at is the service providers and how we can actually improve health delivery for young people. So I would put it, just to add on what Yemurai say, I would basically say that. Yeah.
Thanks so much, Tikala. I think both of you have touched on really key key things and key issues and priorities, but also recognizing this is not just a siloed conversation. There are many different aspects that feed into each other related to health issues, and it's not just these siloed issues separately, but all of these are integrated, and so we need to be thinking holistically when we're trying to prioritize some of these issues. I'm going to send it back now to Zanele to continue this conversation.
Thank you very much, Diane, as well as the panelists for answering the question. Yes, indeed, health issues do not exist in silos, and they have to be looked at in a holistic manner. So just moving on, and from the answers that we have received from our panelists, is how can governments and global leaders be held accountable to steward resources and time into improving the health of adolescents? So that is the question that I'm putting onto the table now for answering by our panelists. So I'll start with you, Itaka. If you could just give us your perspectives on how governments and global leaders can be held accountable to steward resources and time into improving the health of adolescents.
Okay, thanks, Anela. Funny thing is, I was actually asked the same question in our panel discussion at the consultation in South Africa, so I was gladly able to answer that. One thing that we can do as young people is what we did at the consultation is we came up with a proposition where we set out our recommendations and what exactly we want to see from this global strategy. And with that document already, I feel like as an advocacy too, that young people can take, especially young leaders working in these issues, can take within their respective national countries and within the ministries and be like, we came up with this document and this is what we want to see, in terms of just creating some sort of influence within the ministry with that document. Another thing is, we talked about there's a need to include young people within decision-making meetings and committees, because when you're part of the policy making, for example, of that document regarding to health issues, you're really at a place of holding a leader accountable, because you were there setting that policy with the ministers, with the leaders, and you'll be able to go up to them and be like, how far are we with this? What are you doing? Let's see the budget. So there's something really powerful about inclusion when it comes to policy making. And when you look at international agreements that most of our head of states have signed, we talk about the international commitment on economic rights. A lot of head of states have signed that, and right to adequate health is a #1 priority in that, and they've committed to that. And for me, I feel like head of states and government leaders already have got an obligation to human right, and for me, already government leaders should take that into consideration, and they need to do something about it. I mean, I wish it could be enforceable in court, where if it's not being provided within the policies within government, we could actually take our government to court and be like, do something about it. I hear South Africa actually has their constitution as a right to health within the constitution, and many people have actually approached courts and actually services provided. So I feel like that's something in future most of the countries we can learn from, in terms of putting it as a right that you can actually enforce with courts, so that you ensure that the government is actually doing their job and they're on their toes in actually providing these services. Yeah.
That was a very thoughtful and powerful answer, Tikala. Thank you for that. And I mean, Yamara, you did mention that we have to create a conducive environment, an inclusive environment for young people to have the ability to access resources. And it's not just only sexual reproductive health and rights, it's also with relation to sanitation and all the other basic needs that young people need. So I just want to pose the exact same question to you, Yamara, and see if you can have any contributions to the question of how governments and global leaders can be held accountable to steward these resources and time into improving the health of adolescents.
Thank you, Zanele, and Thank you, Tikala, also for a response, although I feel like she already has a head start because she addressed this last week, so she's been meditating on it. But yeah, first of all, I think I'd want to appreciate the work that different young leaders do within their countries. Especially, I'd like to mention the work of AFRIAN. Tikala is from AFRIAN Namibia. I know there are about 30 or so additional countries that have AFRIAN networks. And I just want to applaud the work that youth do, and thank you, Zanele, and thank you, Diane, also for the work you do for accountability's sake. I want to point out that we have to be involved in a lot of the closed spaces where real hard people affecting decisions are made. Because if we are not there when leaders make decisions in private, then it becomes very difficult for us to hold them to account in public circles. We need to get into different platforms. It could also, that includes within the UN, within high-level negotiations in the United Nations. I'd like to appreciate also the increased participation of youth in these platforms. Because when we learn the language and when we learn what goes into the negotiations there within those closed high-level spaces, it's easy for us to go back and be able to negotiate using the language that our decision makers understand to make sure that they're held to account. So we break the barrier that usually exists in terms of public awareness of what policymakers and other decision makers know and what the people know. So I think that's important. But also in terms of resources, if we really are going to get the job done, I think we need to strengthen the data that we have on adolescents and youth health. This includes having indicators that speak on the amount of financing that is provided for adolescent health, as well as the amount of programs that are carried out around adolescent health. That should also include indicators on, for example, youth mental health, issues of interpersonal violence in adolescents, as well as child marriage, including adolescent pregnancy, HIV infection rates, AIDS-related deaths. We need to have a good, strong core set of indicators that will allow us to then eventually hold our governments to account. So to measure their progress and to make them accountable, we need a good set of indicators, as well as increased participation of youth in the often closed spaces where a lot of decisions are made. So yeah, that's what I'd say.
Thank you, Yemurai. We definitely do need to strengthen data that we have on adolescents and other related issues if we want to hold our governments accountable for some of the issues that we are advocating for. Now we'll go on to our social media platform to see if there was an audience that did submit any questions for our panelists. Do remember that if you are tuning into the Google Hangout, you can pose your questions on Twitter by using the hashtag #CommitToDeliver. So we'll cross on to Diane, who is looking at the social media participation for one question that we'll pose to the panelists. Thereafter, we'll have another question before we wrap up the session. So Diane, can you give us any questions for our panelists?
Thank you, Zanele. Well, the conversation is happening online, and I do have a question that is being posed by the Coalition of Adolescent Girls, and they would like to know what are the best ways, what do you see as the best ways to engage young people in the actual implementation of the global strategy. So Tikala, we can go to you first, I think, for that question. What are the best ways to engage young people in the actual implementation of the strategy?
Thank you so much for that question. I will talk based on experience. Usually when we go to meetings where we talk about agreements like the global strategy, as a youth, my mission is to take that document and ensure that I mobilize young people working on these issues and ensure that they are aware that this document exists. So one thing that you need to ensure is you're a coalition, so you probably work with youth organizations within your respective countries as well. So you ensure that you have contacts for, or and the contacts of all the representatives of these organizations, and give them that information, educate them and empower them on the global strategy. Have a dialogue where you guys discuss together on what can we do about it, because I always feel like you can't work in isolation with these issues. You really need a lot of, like I said, collaborative work. So mobilizing young people, having dialogues with young people, using social media. If you have a Facebook page, hit on a discussion on your Facebook page about it, just to get people talking. Use radio and talk about it on radio. Use the newspaper. So it's more about just creating dialogues and platforms for young people to know that it actually exists, and hearing their side of it, and seeing how you guys can work together on actually pursuing the agendas on the global strategy. So yeah.
Thank you, Tikala. I really think you touched on a key point, and that is really helping young people to understand what the global strategy is. I think a lot of times we're only talking about these things in high-level spaces, and the global strategy, as Zanele said, is a large document that really needs to have hands and feet to it to be implemented successfully and correctly. And so I think your point of just educating what is the global strategy is a first step and a needed step in these conversations with young people. Yemrai, do you have anything to add?
Yeah, just a little bit. I think, okay, as youth and also adolescents, we in essence are the global strategy, because the next 15 years essentially belongs to us, and we will grow into it and be the main influencers of whether it succeeds or not. So I would say, first of all, we need to organize ourselves. I know a lot of young leaders who are carrying out work in their countries around issues of health. I think, as Tikala said, just to add on, join networks if they're non-existent. Create networks that include organizations working on a broad range of health issues. And the purpose for this is to be able to identify priorities as per the different countries, as per the different provinces, and specific areas in which youth and adolescents live and work in. And to be able to do that will allow us also to contribute to implementation of this strategy. We, as much as we wait for government to carry out work, we also have a role to play to use our innovation and good ideas to provide new solutions to adolescent health. So let's do that. Let's organize, let's join networks, and let's prioritize and carry out work that also contributes to the strategy.
Thank you, Yemrai, so much for your thoughts on that. I'm going to go ahead and turn it back over to Zanele.
Thank you for your participation during the conversation. I just have one last question, and that is, young people play a vital role in contributing to the UN Secretary General's global strategy for women, children, and adolescent health. How are you on networks, and what is the process? If we could hear the perspectives from Itaka and on.
Hi, Diana. I think if you could please just repeat that question, because I didn't get it very well.
Yes, I think Zanele might be having some technical issues, but I'll just pose the question. So young people play really a vital role in contributing to the UN's global strategy. So, what progress have you seen that's been made for adolescent health, and what opportunities do you see exist in the new SDGs? Tikala, we'll go ahead and go to you first.
Okay, cool. Thank you so much. I think on our side, you would say including young people in this documentation already, I think, is progress. We were talking about how a few years ago, 5 years ago, when the Millennium Goals were being made, or when the Sustainable Goals were being made, young people weren't really involved in that document or reviewing that document than they are now. So the involvement of young people actually in even reviewing the global strategy is progress in itself. The fact is, a lot of stakeholders and the government are talking about their involvement and inclusion of young people already is a progressive step, because before it was this thing of young people are supposed to be seen and not heard. So now we're at a different perspective where the contribution that young people are making is becoming something so effective that could actually improve the health issues that we're facing. So I would say for me, then it's one thing that I would just want to touch on in terms of the inclusion of young people has been progressive in regards to the global strategy. Yeah.
Zanelli, are you back online? We'll just pose the same question to you, Yemurai. What progress has been made, and how do you see opportunities existing in the new SDGs?
Okay, thank you, Dan. I would have said what Tikala said, but I'll just have to add. I think one of the good things that has happened is like there's been a large-scale reduction in maternal mortality. Fewer mothers are dying from the complications of pregnancy and childbirth than was the case before. Part of that is also young mothers. It's something that's quite exciting. Also, the percentage of newborn deaths has reduced as well, which is also exciting because it offers then more opportunities for us to then scale up on what has already worked. So I think it's good to learn about what has worked to reduce maternal mortality and to see how we can use that to specifically reduce the risks that adolescent mothers face, which sometimes are 5 to 10 times higher than mothers within other age brackets. And also to learn about what has worked to reduce newborn mortality, because we also know that young mothers also face increased risks, health risks, that then put their babies at risk as well. So just learning from those two would be really good. But I'm also happy that the Sustainable Development Goals discussion includes some discussion on specific issues like child marriage, that it looks at a more holistic perspective of overall development, because it means that we're looking at economic issues to do with education, issues to do with sanitation. So creating all those linkages means that we'll be able to build up a healthier, better empowered youth generation instead of the specific issues that the previous MDGs looked at. So that's all I'd say is it from my end.
I think Zanelli might be having technical difficulties still. But I just want to thank you so much, Tikala and Yemurai, for your contributions. Zanelli, are you back online? Okay, I think she might be having a few technical difficulties. But I just want to, in closing, give you all just 1 minute to share some closing thoughts that you have regarding this topic. So Tikala, we can go to you, and then we'll go to Yemurai as well.
Thank you so much. Firstly, it was such an honor and a privilege to be part of this discussion and to just be involved in just giving my what I know and my expertise in regards to the issues. In closing, I wanted to say, I know we've been talking about the global strategy, but it's not about the global strategy itself. It's about the key issues that in our face as young people, as stakeholders, civil society, as a government. I feel like the health issues, it's in our face, it's in our communities. There's a need, and it's a need and a call that we need to answer, despite what the document said. I always feel like we know what the problems are, we know what the solutions are, and it's just about taking action and doing something about it, despite the document itself. I feel like the global strategy should merely be a supplement to what we're already doing. So I think my encouragement is, if they're young people, youth organizations already working on these issues, don't depend on when this global strategy adopted. Don't depend on when the policy will be issued out or when the budget will come up from government. You're ready with what you're doing. Keep doing what you're doing, and you'll find that people will join you. Stakeholders out there will join you. So just keep doing what you're doing, supporting the communities, working with young people. And through that, I think as young people, we've created a movement that is getting civil society and the government to react and also join the movement. So with that, I would say take action, do something about it, and enjoy every minute of it. I think it's very fulfilling, and we're making a difference. So join us in what we're doing for those who haven't yet. Yeah, that's about it.
Thank you, Tikala. Yemurai, do you have thoughts to add?
Yeah, I think I'm very excited that we have this level of youth engagement for this type of global strategy. It's really good. It's really fun. And I think it's an encouraging thing for all of us as young people, and especially for adolescents who the strategy also seeks to address. So what I'll just say is we need to make use of this involvement. We need to make good use of the spaces that are made available to us. We need to also take ownership of the strategy within our countries and be part of those who help deliver for women, children, and adolescents. We don't have to wait for someone else to do it. We also have the ability to do it ourselves. Then also, just broadly, I think I just want to urge different stakeholders responsible for adolescent health programs not to start solving the problems of adolescent health from the mortuary going back. By that I mean not to have to wait until we die or we are at risk of dying before addressing the challenges of facing youth and adolescents. We need to be able to attach ourselves to the vision of allowing adolescents and youth to thrive. And that means going above and beyond to feed the potential of youth by providing for universal primary and secondary education, by protecting adolescents and youth from otherwise harmful practices and other things that would otherwise put youth at threat of experiencing the challenges of disease. But overall, I think we have a good strategy. It's building up. We have a lot to be optimistic about, and I'm looking forward to what the next 15 years will bring.
Okay, thank you so much, Yemurai, and thanks to Diane as well for bridging in for me as I was having a bit of technical difficulties. But I just want to also reflect on this conversation and the UN consultations that we did have in the past week, and just say that, as Yemurai had said, I wouldn't be able to reiterate what you have said, both of you, in better words, but we are, as young people and adolescents, the global strategy. And on a national level, national leadership just has to make sure that they continue to prioritize adolescents and youth health and invest in health systems as well as resources so that the young people and adolescents, even children and women, are able to access them. And then on just a community level, that young people should involve themselves in all that they contribute to creating the world and the future that we want. And yeah, we have to make sure that adolescents and youth priorities are at the top of our minds. And I do once again just urge and encourage young people to adolescent health and women and children's health as well. Diane, do you have any closing remarks?
Yes, thank you, Zanele, for just that great summary. I want to thank all of our panelists on behalf of Girls Globe and also on behalf of the Partnership for Maternal and Newborn and Child's Health for participating in this conversation today. Zanele, I want to thank you so much for moderating this panel as well. I just want to point everyone to, in continuing this conversation, you can continue to follow the hashtag #CommitToDeliver. You can also follow Girls Globe, as we'll be continuing in this discussion in the coming months, as well as visiting the website womenchildrenpost2015.org. And you can still participate by commenting, sharing your thoughts and comments, as well as taking a second survey that is on that website available to you. And all of your feedback and all of your voices and comments will be heard and shared in a second summary document that will feed into the renewed global strategy for women, children, and adolescent health. So your voices do matter, and they are being heard in this conversation. So thank you all to those that joined online and to our amazing panelists as well. We look forward to continuing the conversation. So thank you.